cardiac surgeon, warns, this drug is damaging the hearts of older adults. I'm about to tell you something that might genuinely shock you after the age of 60. The biggest threat to your heart isn't always high cholesterol, diabetes, or high blood pressure. Very often, the danger comes from the everyday medications sitting quietly inside your own bathroom cabinet. The drugs I'm about to talk about aren't exotic or rare. They're the same ones you've probably taken this week without a second thought. The pain pill you swallowed this morning, the stomach protector you rely on whenever your gut feels irritated, the cold and congestion medicine you grabbed from the pharmacy, and even the calcium supplement you've trusted for years, believing it was strengthening your bones. I'm a cardiac surgeon, and after more than 20 years inside operating rooms, I've watched hearts that look strong on the outside collapse, not because of a brand new disease, but because of medications people believed were completely safe. In today's video, I want to walk you through 5 common drug groups that silently weaken the hearts of older adults. And more importantly, how to protect yourself without panicking or stopping your medications on your own. Watch closely because what you learn here may save you from an emergency hospital visit you never saw coming. The scary part about these risks is that most doctors don't have the time to explain them fully. It's not because they're hiding anything. It's because appointments are short. And even we struggle to keep up with the constant wave of new research. Pharmaceutical companies certainly aren't rushing to highlight the darker sides of their best-selling products. So in this video, I'm not here to frighten you. I'm here to help you understand exactly what you're taking. We're going to go through 5 groups of medications that almost every person over 60 has used: anti-inflammatory painkillers, stomach medications that protect the gut cold, and sinus medicines, certain older antidepressants, and calcium supplements. You'll see why these drugs become more dangerous as we age and, most importantly, how to talk with your doctor about finding safer options for your heart. Let's begin with the medication group I see most often behind sudden heart failure in the emergency room: anti-inflammatory painkillers, also known as NSAIDs. You know them by their familiar names: ibuprofen, naproxen, diclofenac. They're the pills you reach for when your head aches, when your back stiffens, when your knees are sore from arthritis. And to be fair, they work incredibly well. No one denies that. But after 60, especially if you have high blood pressure or underlying heart disease, taking these pills every day is like gambling with the only heart you have. Let me tell you about Michael, a 72-year-old man who adored the garden behind his house. Every day he went out to trim water and care for every little rose bush. Like many people his age, the pain in his knees and lower back slowly grew worse, and instead of bothering his kids or making extra clinic visits, he chose what he thought was the simplest solution. He took a few NSAID pills each day so he could keep working in his garden. For a while, everything seemed fine. But one afternoon, while bending over his rose bed, he suddenly felt drained short of breath, his chest heavy, his ankles swollen so tightly that his sandals no longer fit. When he arrived at the hospital, we found him in acute heart failure. His aging heart, already carrying the burden of years of mild hypertension, was suddenly forced to pump far more fluid than usual, and it simply couldn't keep up anymore. And the trigger wasn't a new heart condition. It was the anti-inflammatory pills he had been taking almost every single day, believing they were harmless. So why are NSAIDs so dangerous? First, they cause your kidneys to retain salt and water. Think of your blood vessels like a network of pipes, and your heart as the pump. When you suddenly add more fluid to the system, that pump has to push harder and faster. A younger heart can usually handle that, but after 60 or 70, when your vessels stiffen and your heart loses some of its strength, that extra load can quickly become too much. Second, NSAIDs constrict blood vessels and raise blood pressure. Even if your numbers were stable before, daily use can push them higher. And if you're already on blood pressure medication, NSAIDs can actually weaken the effect of those drugs, allowing your blood pressure to creep upward without you realizing it. There's one more thing many people never hear if you take low-dose aspirin for heart protection. Certain NSAIDs, especially ibuprofen, can cancel out its protective benefits. It's like quietly removing the armor from your heart without meaning to. Not all risks are equal, though. Studies show that high doses of diclofenac and ibuprofen, around 2,400 milliliters a day, carry higher cardiovascular risks. Naproxen at low doses appears less risky, but the risk never drops to zero, particularly when used long-term. But here's what I want you to truly understand. The solution is not to suffer in silence or live in constant pain. The real solution is to sit down with your doctor and ask, given my age and medical history, what is the safest pain relief option for my heart? For many people, the right dose of acetaminophen, paracetamol, is enough. For others, topical anti-inflammatory gels, physical therapy, or lifestyle adjustments dramatically reduce the need for NSAIDs. And if NSAIDs are absolutely necessary, the golden rule remains the same: use the lowest effective dose for the shortest possible time. Daily casual use. The take a few pills just to get through the day mindset is what puts your heart at risk. NSAIDs are only the beginning. Now let's move to the second group of medications, ones that nearly every older patient I meet is taking: proton pump inhibitors. The stomach protection drugs like omeprazole, pantoprazole, and lansoprazole. Now let's move into the fourth medication group, PPIs, the drugs many people call stomach protectors. Millions of older adults take them every single day. Some were prescribed after taking NSAIDs, others grabbed them off the pharmacy shelf because of heartburn, bloating, or reflux, and most people believe these pills are completely harmless. But the truth is far more complicated. Let me tell you about Helen, a 68-year-old woman who had lived with chronic acid reflux for years. Her doctor prescribed omeprazole and told her she could stay on it long term. Her discomfort disappeared, so she kept taking the medicine without a second thought. It became as routine as brushing her teeth. Until one day, during a routine checkup, her ECG showed worrisome irregularities, and her blood work revealed something even more alarming. Her magnesium level had dropped dangerously low, low enough to trigger serious arrhythmias. What happened to her came from the very same pill she believed was protecting her. PPIs can affect the heart in unexpected ways. When you suppress stomach acid for too long, your body struggles to absorb key minerals, especially magnesium. And magnesium is not just a nutrient, it's the quiet guardian of your heart rhythm. Without enough of it, your heartbeat becomes unstable. I've seen so many patients walk into my office complaining about palpitations or strange skip beats, and when we check their labs, their magnesium is depleted, almost always after years of taking PPIs. There's another layer to this story. Large population studies involving hundreds of thousands of people have shown that long-term PPI use is associated with higher rates of heart attacks. The mechanism isn't fully settled, but the strongest theory suggests PPIs reduce nitric oxide, a molecule that keeps your blood vessels flexible and healthy. When nitric oxide drops, vessels stiffen, become more vulnerable, and the risk of blockage rises. And yet, there's still more. Many patients never hear that omeprazole can weaken the effect of clopidogrel, an essential blood thinner used after heart attacks or stent placement. When that happens, people lose their protection against clots without realizing it, and the consequences can be devastating. But here's the most important point. PPIs aren't dangerous by themselves. The real danger lies in how we use them. These drugs were designed for short-term treatment, 4 to 8 weeks. But today, countless older adults take them for years, even decades. They take them just in case, take them out of habit, or take them without ever being reassessed. No one checks their magnesium, their vitamin B12, or how long-term acid suppression might be affecting their blood vessels. So, if you're taking a PPI every day, don't stop abruptly. Stopping too quickly can cause a rebound surge of acid that's even more painful than the original problem. Instead, talk to your doctor and ask the 4 questions that every patient over 60 should know. Do I truly need to take this long-term? Can we step down the dose or take it every other day? Is there a safer alternative? And do I need periodic magnesium testing? If long-term use is necessary, then long-term monitoring is necessary too. PPIs aren't a perfect shield. After 60, they can quietly open the door to heart problems if taken incorrectly or for too long. And if what I've shared so far has surprised you or helped you understand your medications better, I want to ask you for 2 small favors that could make a huge difference. First, hit subscribe. I make these videos for people over 60 who deserve honest, straightforward medical information without complicated jargon. With one click, you won't miss any of the warnings that could protect your heart. Second, share this video with someone you care about. Your parents, your friends, a neighbor who might be taking these same medications. A simple share might prevent a heart failure episode, a hypertensive crisis, or a hospital stay that never needed to happen. Sometimes one video is all it takes to change someone's health trajectory. Thank you for being here. Now let's continue with the next medication group. Something that looks harmless but sends many older adults to the emergency room. Each year, the common decongestants people take for colds and congestion, especially those containing pseudoephedrine or phenylephrine. These pills sit on store shelves with bold promises. Clears congestion fast, breathe easier in minutes, and when your nose is blocked and your head feels heavy, you just want relief. But after 60, especially if you have high blood pressure or heart disease, these quick-fix pills can become a dangerous trigger. Let me tell you about Margaret, a 75-year-old retired teacher. One winter, she caught a stubborn cold, runny nose, severe congestion, sleepless nights. She bought a popular cold medicine containing pseudoephedrine. The first day, she felt her nose open up and thought the worst was over. But the second day, everything changed. Her heart pounded violently against her ribs. A splitting headache hit her. She felt dizzy and faint. Her son rushed her to the hospital. Her blood pressure had skyrocketed and her ECG showed she'd slipped into an arrhythmia. The cause wasn't a new heart condition. It was the decongestant she took to breathe easier. Pseudoephedrine and phenylephrine constrict blood vessels. They shrink the swollen vessels in your nose, yes. But they also constrict vessels throughout your entire body. And that creates two dangerous effects. First, when arteries tighten, the heart must pump harder. Pressure rises quickly. For an older heart already dealing with hypertension or coronary disease, that sudden spike can trigger chest pain, heart failure, or even a stroke. Second, these drugs stimulate the sympathetic nervous system. Younger adults may only feel a mild jitteriness, but older adults, especially those with arrhythmias or heart disease, can slip into dangerous rhythms like atrial fibrillation. That's why European health agencies recently reevaluated pseudoephedrine's safety after rare but severe cases of brain vessel constriction were reported. It's a reminder that these medicines affect far more than your nose, and the real problem is how easy they are to access. No prescription, no warning conversation. Just pick it up, take it, and hope for the best. So if you're over 60 or living with heart disease, avoid oral decongestants containing pseudoephedrine or phenylephrine. Choose gentler, safer options. Saline sprays, humidifiers, warm steam, or in some cases a doctor-guided nasal steroid spray with minimal systemic absorption. Don't let a few nights of congestion turn into a heart emergency. Now in the next section, we're going to talk about another medication group that doesn't sound like it has anything to do with the heart, but it does. These older antidepressants, often prescribed for nerve pain, insomnia, or chronic discomfort, can quietly disrupt heart rhythm, blood pressure, and even increase fall risks in older adults. Which brings us to Frank, a 78-year-old man with diabetic nerve pain. His doctor prescribed a low dose of amitriptyline to help him sleep and ease the burning pain in his feet. At first, it worked beautifully. He slept better. The pain eased. But then Frank began feeling dizzy every time he stood up. He brushed it off as age is fatigue, until one morning he stood up and collapsed, breaking his hip. At his age, a hip fracture can change the entire course of someone's life. And the root cause wasn't age. It was the amitriptyline affecting his blood pressure, heart rhythm, and ability to maintain balance. So why are tricyclic antidepressants so risky for the heart and blood pressure, especially after the age of 60? The first reason is something many patients have never heard of: orthostatic hypotension. These medications can cause your blood pressure to drop suddenly the moment you stand up from sitting or lying down. When that happens, blood doesn't reach the brain quickly enough, and that moment of dizziness, that wave of faintness, can turn into a full collapse. In younger adults, it's often just a wobble. But in older adults, that one fall can mean a fractured hip, a broken spine, or even a head injury with bleeding in the brain. Many of those mysterious bathroom falls I've treated over the years were not mysterious at all. They were caused by a medication like amitriptyline. The second issue is the increase in resting heart rate. TCA medications stimulate the sympathetic nervous system, nudging your heart to beat faster even when you're relaxed. For a heart that's already dealing with coronary artery disease or early heart failure, this constant speed-up is like forcing an old engine to run in high gear all day long. It wears out quickly. And then there's the part that keeps cardiologists awake at night, the electrical effects. TCAs can disrupt the heart's electrical conduction, slowing signals, stretching certain intervals on an ECG, and increasing the risk of dangerous arrhythmias coming from the ventricles. These are the types of rhythms that can turn life-threatening within minutes if no one is nearby to help. In older adults, even a minor electrical disturbance can escalate into something far more serious. So what should you do if you or a loved one is taking amitriptyline or imipramine? The first step is not to panic and definitely not to stop the medication suddenly. Stopping abruptly can bring back nerve pain, insomnia, anxiety, and a host of withdrawal symptoms. The key is to talk with your doctor. Ask whether this drug is still the safest option for your age, whether there's another medication that can help without burdening your heart, and whether you should have your blood pressure checked in different positions or get periodic ECGs. The good news is that we now have newer medications that are much safer for older adults and offer the same benefits with fewer cardiovascular risks. And now we arrive at the most controversial group of all. The supplement that millions of people take every day believing it will strengthen their bones. Yet year after year, more studies are showing that when used incorrectly, it may actually harm blood vessels and increase the risk of heart attacks. I'm talking about calcium supplements. And trust me, this is a section you'll want to hear. Let's step into this final group. Calcium pills are taken daily by older adults everywhere, often without guidance, without lab tests, and often with the belief that more calcium means stronger bones. I wish it were that simple. But the science paints a very different picture. Now, we arrive at the first medication on this list, the one that has sparked the most debate in recent years, calcium supplements. For decades, the message people heard was simple and repeated endlessly. If you want strong bones, take calcium. Doctors said it, health pamphlets said it, advertisements shouted it. And because of that, countless adults over 60 take calcium every single day. Some even double the recommended dose, believing it will protect them from osteoporosis and fractures. But the human body doesn't work that simply. To help you understand what I mean, let me tell you about Linda, a careful and thoughtful 70-year-old woman. She was someone who took her health seriously. When her friends told her that taking high-dose calcium would prevent fractures, she went out and bought a strong supplement. And she took it every day for years. What's striking is that Linda didn't smoke. Her blood pressure was normal. Her cholesterol was good. She ate well, walked daily, and did everything right. And yet one day she suddenly ended up in the hospital with a heart attack. No one could understand why. When our cardiology team reviewed her entire medical history, one detail stood out: years of taking high-dose calcium supplements. And that raised the question we're now asking more and more often. Could the very pill she believed was protecting her bones have quietly contributed to the damage inside her arteries? So how can a simple calcium tablet cause harm? First, calcium from food is safe. Your body absorbs it gradually at a controlled pace depending on what your bones and tissues actually need. But calcium in pill form enters the bloodstream fast. Within 30 to 60 minutes, you get a sharp spike in calcium levels, and your body can't instantly move all that excess into your bones. So where does it go? That leads us to the second issue. Large studies have shown that when blood calcium rises suddenly, some of the excess can deposit inside the arterial walls. Over time, this contributes to something called arterial calcification. When that happens, the arteries become stiffer, more fragile, and more prone to plaque buildup. And that combination increases the risk of heart attacks. Now, it's true that not every study reaches the same conclusion, but the overall pattern is strong enough that many experts now urge caution, especially for older adults who take calcium for years without medical supervision. And that brings us to the third point. The risk-benefit balance is not the same for everyone. Someone with advanced osteoporosis may still need calcium because the benefit outweighs the risk. But someone who is not deficient and is taking high-dose supplements on their own may be exposing themselves to unnecessary danger. The greatest risk comes from long-term, unsupervised use. So if you're taking calcium every day, what should you do? First, don't take high doses on your own. More calcium does not mean stronger bones. Sometimes it just means more burden on your arteries. Second, prioritize calcium from food. Your body handles it in a far more natural and controlled way. Third, only take calcium supplements when medically indicated. Your doctor will consider your bone density scan, your blood calcium levels, your kidney function, and your cardiovascular risk before deciding whether supplementation is truly necessary. And lastly, avoid taking these pills based on habit or guesswork, especially the high-dose combination products that are marketed aggressively. We've now walked through 5 groups of very common medications that can have serious effects on the hearts of adults over 60. Anti-inflammatory painkillers that cause fluid retention and sudden spikes in blood pressure. Stomach medications that quietly drain your magnesium and interfere with heart-protective drugs. Decongestants that squeeze your blood vessels and send your pulse racing. Older antidepressants that can make your blood pressure crash the moment you stand up. And calcium supplements that, when taken the wrong way, may play a role in hardening the arteries. But my message today is not that you should stop your medications. In fact, stopping suddenly can be dangerous. The real message, the one I want you to take with you, is this: become an active partner in your own care. Understand what you're taking, ask the right questions, know why every pill is in your routine. At the very end of this video, I'll help you pull everything together into a simple set of questions that every adult over 60 should ask their doctor before continuing any long-term medication. And I'll leave you with one piece of advice that can protect your heart for many years to come. Today, we opened the familiar medicine cabinet of older adults and uncovered the hidden risks that very few people talk about openly. Now, I want to close everything out in the simplest, most practical way so you can start using this knowledge right away. Let's take a moment to summarize what we've covered. Anti-inflammatory painkillers like ibuprofen, naproxen, and diclofenac can cause water retention, raise blood pressure, weaken the effect of heart medications, and push an aging heart into failure. Proton pump inhibitors, when taken for years, can deplete magnesium, trigger arrhythmias, interfere with critical cardiac medications, and may be linked to higher cardiovascular risk in some studies. Cold medicines with pseudoephedrine or phenylephrine constrict blood vessels throughout the body, pushing blood pressure dangerously high and speeding up the heart, something that can be life-threatening if you already have hypertension or heart disease. Older antidepressants like amitriptyline and imipramine can cause severe drops in blood pressure when you stand, leading to dizziness and falls, while also speeding up the heart and disrupting its electrical signals. And long-term high-dose calcium supplements can create sudden spikes in blood calcium, potentially contributing to arterial calcification and heart attacks, especially in people who aren't truly deficient. If something in this video surprised you, I'd love to hear your story in the comments. Have you ever had trouble with pain medicines, stomach pills, cold remedies, antidepressants, or calcium supplements? Do you have a parent or loved one over 60 who is taking many medications every day? Your story could be the one that helps someone else recognize a risk before it's too late. And if you found this video helpful, make sure you subscribe so you don't miss future warnings about heart health after 60. Share this video with at least one person you care about, someone who may be taking several medications but has never once asked the question, are these actually safe for my heart? Remember this. The most important step you can take for your heart today isn't a new pill. It's an honest conversation with your doctor. Care for your heart now so tomorrow you can continue walking freely, holding your grandchildren, and living life the way you want.